So far, this presentation has focused on helping you recognize issues that impact the well-being and serviceable soundness of the therapy horse. Now we're going to discuss some of the things your staff should know how to do to help program horses remain serviceably sound and useful. For starters, every volunteer should be able to recognize signs of poor fitting tack. While it may not be possible to get a custom saddle for a back-sore horse, there are often simple, inexpensive fixes for saddle imbalance. When evaluating saddle fit, one of the most important and easily fixed issues is front-to-back balance. Imagine there is a ball on the saddle. If balanced, the ball should want to roll towards the middle of the seat. This saddle forces the rider's weight too far back. Folding two quilted wraps and placing them under the rear of the saddle allows the rider to sit in the middle of the seat. Program staff should know how to assess back pain. The best time to do so is before and after saddling as part of the grooming routine. All too often, people test for back pain inappropriately and get a false positive response. Running a sharp object, such as a pen or needle cap, down the back will elicit crouching in most animals, even those without back pain. Sharply poking or prodding an area without having initial contact with the finger on the body will also elicit a false positive. If someone pokes you suddenly with a finger that is not first already contacting your body, it feels much more invasive than if they had gently placed a finger on you and then pressed in. There is an automatic defensive tightening or clenching when poked. To avoid a false positive response, it is necessary to apply pressure in the correct location and in the correct manner. This video will help you assess your own horse's back for tenderness of the overlying musculature as well as the major joints of the spine. There are three major locations to palpate when testing for spinal pain in horses. These locations correspond to the most mobile joints in the horse's back. Digital pressure over the thoracolumbar joint, the lumbosacral joint, and the sacroiliac joints can help determine if spinal pain is present. The thoracolumbar joint lies underneath the cantle of the saddle. The iliopsoas muscle complex, which pulls the entire hip and hind leg forward, originates underneath this joint. Pain in this region can speak to saddle issues or issues in extension of the hind leg. The thoracolumbar joint is most easily found by touching the soft part of the upper loin and moving your hand forward until you run into the last rib. Follow the back edge of this rib up to where it intersects with the spine. You won't feel the rib all the way, as the head of the rib is buried underneath the long back muscle. Just follow the same line until you intersect with the spine. This is the thoracolumbar joint. Feel the width of the vertebrae. Place your index finger about 1 inch off the edge of the vertebrae. If you are on the vertebrae, you will get a false positive. Place your other index finger in the same location on the opposite side. Make sure you have your fingers perfectly perpendicular and just touching the horse, but not yet applying pressure, so the horse knows you're there. In a smooth, steady, sinking motion, push straight down with your fingers and count 1001, 1002. If there is pain in this joint, the horse will crouch and flinch. Release the pressure after 2 seconds. The horse in this first clip does not have back sensitivity. April Johnston is palpating for the last rib and then sliding her fingers towards the spine until she contacts the vertebrae. Then she spreads her fingers out 2 inches to either side and then presses down with steady, even pressure for 2 seconds. Yeah. Notice this was the same mare that had crouched and displayed an irritated expression when a pen was used to perform the back test. Using the same technique and pressure, this next mare displays mild sensitivity to thoracolumbar joint palpation. To find the lumbosacral joint, follow the line of upward growing hair just in front of the flank to where it intersects with the back. Be about 3 inches off either side of the spine, as the lumbar vertebrae are quite wide. To test for pain in the lumbosacral joint, you will use the exact same pressure method as for the thoracolumbar joint.
So show the hair growing up here.
This mare displays extreme sensitivity to lumbosacral joint palpation. Watch as April finds the joint by following the hairs up to the spine, spreading her fingers about 3 inches apart, and pushing down with steady, even pressure. The mare buckles from her fingers. To test the sacroiliac joint, you must find the tuber cocci of the pelvis. This bony prominence sticks out to the side of the horse's hip region. Curl your fingers around the top of the tuber cocci and sink your fingertips steadily in, like you're going to try to pry the bone away. If the horse has pain in the SI joint, he will crouch and buckle. Be sure to test both sides of the pelvis individually. This first horse does not react at all as April presses against the tuber cocci, which puts pressure on the sacroiliac joint. The second mare mildly flinches as April presses against the tuber cocci. All horses, but particularly those with back sensitivity, benefit from range of motion exercises. Just like us humans, stretching is beneficial to prevent stiffness and soft tissue adhesions. Equilibrium Institute has 4 videos online detailing why and how to properly encourage a horse to stretch. Therapy horses should be encouraged to stretch at least once or twice a week. While we don't have time in this presentation to show all 4 videos, I recommend you check out Equilibrium Institute's YouTube page and watch each of the carrot stretch videos on your own time. Being able to recognize signs of equine stress is necessary for therapeutic riding program staff. Many program horses are such solid citizens that they hide signs of discomfort. Knowing how to take a horse's TPR, temperature, pulse, and respiration, will help you detect stress, which can be an indicator of underlying pain or indicate a veterinary emergency. Taking the pulse in the limbs is just as important as taking the central pulse. Horses with foot pain, particularly due to laminitis, often have increased digital pulses. The digital pulse is a measure of blood pressure in the lower leg of the horse, particularly the hoof. Increased blood pressure within the hoof capsule can cause pain and may be an indicator of trauma or disease of the lower leg. Digital pulses can be elevated due to laminitis, a hoof abscess, sole bruising, or trauma. The pulse you are feeling is blood pressure within the lateral and medial digital arteries. These vessels are located on either side of the fetlock joint. This image details the 3 locations where the pulse is most readily palpable. When feeling for the vessels, make sure you are not accidentally feeling the branch of the suspensory ligament. To feel the digital pulse, stand in front of and off to the side of the horse. Be sure the horse is restrained appropriately and that you are in a safe position should the horse move forward or paw. Place your index and middle fingers of both hands simultaneously along the sesamoid bones of the fetlock joint. Avoid using your thumb, as sometimes you can mistake your own pulse for the horse's pulse. Hold your fingers in place for 15 seconds. There should be 1 weak pulse for every 1 to 2 seconds. In some horses, it is actually easier to find the pulse slightly above the fetlock or slightly below the fetlock, as demonstrated in this video. It should be difficult to locate the pulse in a normal horse. If you're in the right location and cannot find the pulse, that can be normal. If, however, you feel a throbbing or bounding pulse, then there may be an issue that requires veterinary attention. If there is a strong pulse on one side of the fetlock but not the other, then there likely is an issue with that side of the hoof. Practice taking your own horse's pulse when he is at rest so that you know what his baseline normal pulse feels like. Early detection of problems is often the key to successful treatment. Becoming familiar with each horse's baseline normal pulse will allow you to detect a problem early, hopefully before it becomes severe. Bandaging a leg wound and correctly applying standing wraps is a must-know for any staff member. Standing wraps are used to protect the limbs, restrict mobility, and reduce swelling of the lower limbs. These wraps are often applied to stall-bound horses, especially those with weak circulation. So we're going to start by bandaging her lower leg to try and help push the fluid back up into circulation. These are quilted cotton wraps. This particular brand is called a no-bow because it doesn't bow the tendons in the leg. So how you want to wrap it is you follow the direction of the tendons. So on the left front, you're going to wrap from outside in, so counterclockwise. On the right side of the body, you would wrap the opposite direction. You'd be wrapping clockwise. So I start with the wrap on the inside point of her leg, and you're wrapping from knee to about mid-pastern. I'm laying it nice and smooth, and I'm pulling it just tight enough that it lays flat. You think of it like wearing your socks. You don't want them all bunched up inside your shoe because it's uncomfortable. So the wrap's on nice and smooth. Then I use this, which is called nylon track wrap. You can either start over the top, or some people will tuck the wrap in to help kind of hold it in place. And this is where it requires a little bit of dexterity, and practice makes perfect, because sometimes you'll end up dropping the wrap if you're not that familiar with how to do it. But you start from the middle and wrap down the leg first. And the goal is your wrap should cover half of the previous wrap. So I'm going 50%. And I'm pulling it pretty snug, okay? You have to be careful that you don't bow a tendon in a horse's leg by pulling things too tight. But as long as you have a squishy cotton wrap underneath this non-stretchy wrap, you're not going, it's not very easy to get it too tight. So now I went down below the pastern for a little bit of support. And I'm coming back up the leg, covering my wrap about 50% each time. That figure somewhat depends on the length of your horse's cannon bone. You wrap all the way up to the top. You don't want the wrap going over, because then it'll curl in and rub on the hairline. So you want the wrap, a little bit of your cotton wrap to stick out at the top and the bottom. Just making sure it's nice and smooth and even the whole time. And by the time we've finished this bandage, the combination of the cotton wrap and the nylon track wrap is called a standing wrap, because we use these wraps on horses that are standing around and tend to get swelling in the lower leg. We aren't expecting you to learn everything in one 45-minute lecture, but we are hoping you'll be stimulated to learn how you can better serve the service horse. To round out what you've learned today, Equilibrium Institute offers online courses and hands-on workshops for all budgets and schedules. The first aid course and workshop, any of the RACE-approved veterinary technology courses, phototherapy, equine nutrition, and the equine hoof. For more information about Equilibrium Institute, check us out at www.equi-libriuminstitute.com, where we help horses by educating their people.